Dr. Hassan-Ali here from Peds Patrol. I'm a double board certified pediatrician. I just recently posted a video on red flags for babies and I had a ton of comments. One specific comment was regarding how to identify signs and symptoms of sick babies in ethnic children or children with color or melanin. So here are a couple of conditions that you need to know about, and if your babies have these, you should seek medical attention. So this is what looks like jaundice. So jaundice in babies is when there is a high concentration of bilirubin in the body, and some children do require treatment. In ethnic or colored children, it's really hard to assess the yellow hues in a baby's skin. So two ways that you can identify it is either looking in the whites of their eyes, and if they have yellow color, that could be a concern. And sometimes if you press on their skin really, really tightly and then release, you may see some yellow undertones. So if you see any of those signs and symptoms, you should seek medical attention because your child may need treatment or phototherapy for the jaundice levels. So next is cyanosis. So cyanosis is central or peripheral, and what we're really worried about is central cyanosis. And this is blueness around the lips and the tongue, and you can see that right in this baby. So central cyanosis can be caused by many issues, including cardiac causes. So let's say your child has a cardiac condition or cardiac lesion. But it can also be due to respiratory causes, which is usually more common, like things like bronchiolitis, pneumonias, or other types of infections. Central cyanosis is a significant concern. If you see your child with that when they leave the hospital or at home, you really need to call 911 or go to the hospital. So the next skin color to look out for is called pallor, which is usually graying or whitening of the skin. As you can see in this example, this baby definitely looks much more pale or gray or ghost-like compared to the regular complexion of a healthy baby. Pallor can be concerns for things like dropping a lot of blood, not having a lot of oxygen, and in worst case scenario, sepsis or infection. So if you see these colors or concerns, you need to seek medical attention. The last color to look out for is bruising. However, this specific condition is called slate gray nevi. So these nevi can occur in many places on the body, including the lower back, the arms, the head, the chest. And these are very common in ethnic children, but are actually just birthmarks that will go away in a few years. The baby is otherwise very healthy, feeding well, growing well. And these lesions, they typically will resolve on their own without any type of intervention whatsoever. They just look very, very scary, but they're actually quite normal. Let me know if you have any questions or comments, comment down below, and continue to follow Peds Patrol for more tips.